is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to today's edition of Health Talk. Today we have a very distinguished guest, Kevin Berger, Dr. Kevin Berger, local acupuncturist. He is the owner-operator of Thrive in Boyertown and Zieglersville, so 2 locations as we have come to know. Kevin has spent his years dedicated into education, earned his undergrad degree from Kutztown, then went on to study in China in Beijing to become an acupuncturist and a doctor of acupuncture. He brings a lot of experience from Eastern medicine to the Western world, and so we're very delighted to have you as a guest today.
Thanks for having me.
So, obviously, we're going to kind of focus on something that some people have some experiences with, some people don't, and we'd like to kind of expand how acupuncture kind of fits into a Western medicine world. Okay. So, first of all, what's acupuncture?
Acupuncture, probably twofold answer. I think first off, what is the actual modality of acupuncture? And that's basically just the insertion of very fine needles into specific acupuncture points on the body. Okay. And that's to create a desired effect, whatever we're treating in that individual. The second, acupuncture is probably used as a grab-all for kind of all of what we'd call traditional Chinese medicine. Okay. Traditional Chinese medicine consists of acupuncture, herbal medicine, lifestyle counseling, Eastern nutrition, and a whole range of other things. So it's actually, when we say acupuncture, or somebody practices acupuncture, it's generally kind of a catch-all for a whole bigger thing.
Makes sense.
Yeah.
So obviously, as a chiropractor, we know that acupuncture is very, very effective for back pains and neck pains and headaches and those types of things. But what type of conditions do you treat?
I actually treat everything. Sure. It's developed over a couple thousand years as different modalities and different treatments for a whole range of different conditions. Obviously, most things that I see are pain. Mm-hmm. Secondary are probably stress, anxiety, psycho-emotional disorders, digestive disorders, sure. Treating side effects from cancer. A whole range of different conditions. It's really good for neurological conditions, mm-hmm. Post-stroke or post-TIA. Sure. It's really good in kids and pediatrics. Mm-hmm. So really just treating everything.
So from the experience that I had personally with acupuncture, what is actually going on? So when the needles are going into you, I'll start with this, does it hurt? Yeah. And then what's going on there?
Yeah, so basically, it doesn't hurt. They're basically the size of a human hair. Mm-hmm. So they're very, very fine. Most people don't even feel them. Sometimes there's a little bit of sensation. Then what's actually happening when we do the acupuncture, there's a number of different systems that get activated. Okay. We stimulate blood flow circulation. We help control inflammation, so it has an anti-inflammatory effect. When we do acupuncture specifically into knots or adhesions in muscle, we can release those knots or adhesions, therefore creating more space and sure. Improving range of motion in the muscles. It also helps with your nervous system. So it really takes us from our sympathetic nervous system, which is our fight or flight, to the parasympathetic, which is more of our calm, neutral state. So basically it's putting the body in its own natural repair mode. And it also stimulates the immune system. So it triggers an immune response, but also a healing response within the body.
Sure. So when a patient, what could a patient expect to experience as they would present to your office, so with any type of condition? Yeah,
so first off, if they hadn't been there before, we just do a regular, full medical workup on them. And then different diagnostics we use, which are kind of unique to acupuncture and Chinese medicine, are facial recognition, also looking at the eyes, looking at tongue and taking pulse. A lot of good information's in there that the patient may not even be aware of that they're presenting with. Sure. So we want to get a full, complete diagnostic workup for them so that we can treat them properly, even if they don't realize that certain systems are imbalanced. Mm-hmm. Going from there, we would do an acupuncture treatment. So all that information creates a basically treatment plan, sure. or the acupuncture needles and points that we want to use. And you can think of it like a code or a phone number going into the body. So we put that code or phone number in, and it has a certain effect. And then following that, we would wrap up with that patient with any questions or lifestyle advice or nutritional advice, and then we'd go from there based on how they feel.
So, is acupuncture safe?
It's extremely safe. I've never heard of an incident of an acupuncturist or a colleague that I've worked with or knew or heard of that has had an incident. It's very, very safe. Your most major thing that you might experience is a little bruise, but even that is quite rare.
Right.
Yeah.
So when you compare, Eastern medicine versus Western medicine, and you look at how Eastern medicine, such as acupuncture, kind of fits into the model of Western medicine, what do you see? What's the direction that you've been seeing things kind of progress in?
The direction is more positive. When I first started practicing about 14 years ago,
14 years ago.
we were definitely on the fringe, and different MDs and DOs would kind of just, well, we don't know what it is, so we can't really even recommend it.
So you almost have to demystify it, right?
Yes.
Right.
So over time, I think just the education's got there, the research has come up, the stigma, and then just the patients reporting back to their own physicians saying, hey, I'm doing this and I'm getting great results, and them just seeing over time how it's played out. So I think how we're fitting in is that we're still a little bit on the edge because of probably just insurance coverage.
Okay.
That's probably the biggest factor right now. It's not so much the effectiveness. I would say we fit in kind of within the whole model as really kind of standing out in working with the whole body, mind and spirit, when somebody's looking for something where they have a pain, but that pain might be rooted in perhaps a mental imbalance, such as depression or anxiety.
Right.
So we look at towards the root of that, where we treat the depression and anxiety and also the pain, and they would all come together. So it really works well with muscles and nerves. So I think that is where we kind of have our niche within the medical community.
Wonderful. So, we talked about, what a patient could expect. So what does a treatment plan look like? Is that, 3 times a week? Is that once every year? What does it look like for you? And I know it's probably different from, different conditions and patients, but on average, what would your treatment plan layout look like?
Sure. So initially most people come in, and after their first visit, I recommend they follow up sometime in approximately a week. That gives a good space in between the treatment to where the treatment can take effect even a few days out. So if they're following up in a week, they can say, okay, normally my week would look like this, or my condition would look like this, and they would come back and they would report how everything's going, how not only maybe their pain is feeling, but their mood and their energy is. So that being said, based on their response and how fast they're responding, we don't need to see them as often. So I'd recommend maybe once a week in the beginning until they get their condition under control or managed, and then start to move out and bump out to a place where we manage a condition, but it doesn't get to a place where it's acute and active again. Gotcha. That's the ideal plan.
Sure. So if you have, like most people, I would have to say, you have a treatment plan set up, they follow through on the treatment plan, and then they go, on their way into their life at that point, and you don't see them for a period of time. Do you have an idea just offhand what the reoccurrence rate is for a person who has like a GI complaint or low back pain or anything else like that, if they, stop the treatment itself?
A lot of treatments, as long as you get them to where they're not experiencing any signs or symptoms, I'd say most conditions are holding probably about 6 months.
Okay.
To whereas we don't need to see them again because we've actively treated and managed that. And as long as they're doing things on the outside in their diet and lifestyle, which isn't actively triggering or feeding that condition, it should actually hold for quite a while. And if they're doing things which are actively working to help that condition, it will span even further to where we might be looking at a year or so before they have it, or it might not just come back at all, which is good.
For sure. So I have some experience with some knowledge or some education with, I'll say meridian points and meridian therapy and that type of stuff. When you're doing, the acupuncture points and that type of stuff, is there a difference between meridians and acupuncture? Is it all trying to connect energies, or how does it all work, I guess is what I'm looking for.
Yeah.
I'm looking to kind of dive a little bit deeper into what is actually happening when you're putting those needles in.
Right. So great question. So the acupuncture points lie on acupuncture meridians.
Okay.
So you can think of it like electrical running through the walls, and the acupuncture points are the outlets.
Okay.
Okay, so they're on the same line or in the same vein or the same nerve
Circuit, yeah.
pathway or circuit way. They're just the tap-in points. So we can actually do local acupuncture points, and we can also do distal acupuncture points to affect something farther away, such as acupuncture point on the hand for conditions in the head, because it would be along the same meridian and pathway which runs up. So yeah, that'd be the difference between the acupuncture and the actual meridians themselves.
And so again, is that like, are we looking at blocks of energy that's happening, and then do the we'll say the needles themselves unblock things and connect things? I guess that's what I'm looking for.
Yeah, so that's a good way to put it. Traditionally, they would call it something stagnates in an area.
Okay.
Energy, which when we say energy, we sometimes use the word chi, which is translates into energy. But that's basically the energetics of what moves the blood.
Okay.
So we've got a blood, which is a substance, and then we need the energetics behind it. So when we say something gets trapped or stagnated or blocked in an area, basically that chi pulls, or the energy pulls or stops. So you can think of it like if a river or dam gets dammed up.
Yeah.
Okay, the river stops flowing, the water gets stagnant, things are affected both downstream and upstream. So you've got effects all along the line. So what we do with the acupuncture is go in and kind of break up the dam, break up the stagnation, which returns the natural flow to the body. Now that can, one block in an area can eventually lead to other blocks in other areas, especially, think of it like an interconnected waterway or system or nervous system, anything like that. So blockages anywhere can affect actually the entire system over time.
Gotcha. I want to just take a moment just to have people understand your education, and I would like to expand upon that, what it takes to get the degree that you have today. As looking at acupuncture as a doctor of osteopathic and holistic medicine at this time. What is that route? How does that happen, and what do you have to do to attain this?
Yeah, so it's actually a bit more than I think a lot of people realize.
Sure it is, including myself.
Yes, so it's a regular 4-year undergrad, and then it's approximately 4 years of acupuncture and Chinese medicine after that. And that'll get you basically a master's degree in acupuncture and Oriental medicine, and then you can practice after that. I went on further to get a doctoral degree, which is another 2 years.
Okay.
So you're looking at approximately 10, 11 years of actual education over time. Also intermingled in that, probably about 6 years in, you start different internships. Okay. So we would do internships in different hospitals and children's hospitals, and I did internships in neurology departments in China, and military departments, seeing trauma and different things. So a lot of times we actually have quite a diverse Eastern and Western background. We need to know everything that people are coming in and they're describing in Western medical terms. Right. So we need to have all that basic, pathophysiological knowledge. And then we also need to kind of translate that into Eastern imbalances and diseases. Wow.
So with all we've we covered a lot of territory today. What's your take-home message for our viewing population? What would you want them to take away from this episode?
I would say for the most part, acupuncture is something that can be incorporated in whatever they're already doing for their health,
Sure.
whether that be chiropractic, physical therapy, they're embarking on a nutrition plan, or they just want to overall improve their health. It's a good thing to add in because we look at things very differently. So if you've kind of already went through different Western physical therapies and models, it's a good thing to add because we take things, we look at it from a different eye and different perspective, and we tie in mind, body, and spirit. So if you're looking for, kind of something which comes at it from that angle, like a holistic angle that can kind of tie in a lot of the other modalities, it's certainly something to consider.
Wonderful. Thank you for being a guest. Tremendous amount of information. I think that when you look at, the opportunity that we have in this area to have somebody of your skill and your expertise at this point, we are very blessed to have you in this area, that's for sure.
Thank you, Dr. Strester.
Absolutely. Good day and good health.